Thank you for joining me once again. Today we are discussing dyslexia disorder. My name is Obapeni Awojimfua. For dyslexia disorder, it is mainly a learning disorder or a learning skill, writing skill or pronunciation skill disorder. And this doesn't have a limit in relations to age, so it affects both children and adults. These people have problem or difficulties in recognizing and processing speech sounds. Dyslexia does not affect the vision of a person. It primarily affects the language processing. For causes, it can come as a result of neurodevelopmental disorder. It is also genetic related. We also have prenatal exposure to certain toxins and infections. So if you're a mother or a pregnant woman, you'd have to be very careful on the things that you expose yourself to, the infections that you contact. That is why it is important for you to go for antenatals and doctor's appointments. Another cause of dyslexia is environmental factors such as lack of reading materials or illiteracy environment, or when the child has a late literacy support, it can result in dyslexia. So for the symptoms, they have the general symptoms, and then they have symptoms for the kids, and then that of the adults. As I said earlier, this particular disorder doesn't have age limits. It affects both children and then adults. And you see, dyslexia doesn't really come as a result of a teacher's style of teaching. Neither is it related to intelligence. Dyslexia has got nothing to do with your level of intelligence. So for the general symptoms, you see something like they are having problems with decoding and encoding of sounds and then letters. They have fluency in reading challenge. So for kids, you see something like mispronunciation of words and then their inability to read or learn rhymes and then song lyrics. They also mix up similar letters and then they don't have interest in learning letters and sounds. For the adults, they have difficulties in writing and spelling. They also don't have any interest in reading. They don't have interest in reading at all. And because they don't have interest in reading, they get tired easily when you put them to it. They end up making a lot of mistakes when they are reading because one, they don't have the interest and they are tired already. The first two, three lines, one page, they're already tired. So they make a lot of mistakes in the course of their reading. They do not even understand what they are reading. They are reading it because you have asked them to read or because at that particular moment it is a necessity for them to read. But if you ask them if they understand whatever that they are reading, they have no idea. They don't understand it. They are quick to forget names and places. They are so quick to forget names and places. Let's come to the effects. They lack organizational skills, and as a result, they can't even manage their time. They are unable to interact socially. They are unable to free themselves in social gatherings. They can't have that inflow of conversation because of their challenge in pronouncing certain words and also putting certain sentences together. They have a memory effect. They are unable to decode and encode words and then letters. Because of this challenge, which makes them unable to fit in or be in social gatherings and express themselves well, they withdraw, they have a withdrawal effect because they are unable to express themselves well. So they are thinking of what if I say and people laugh at me? What if I say and I make a mistake? So they are always having low self-esteem. They don't have belief in themselves that they can actually do it. And in their low self-esteem, they develop very bad image about themselves because their low self-esteem impacts their self-image. They begin to look down on themselves. They begin to think that other people are better than them. And this mostly affects children. The negative self image impact usually or mostly affects the kids. Anxiety and depression is in almost all the disorders, and dyslexia is one of them. At the end of the day, they fall into anxiety and depression. There is no treatment for dyslexia, but special instructions can help improve the person's learning, writing, and pronunciation of letters and words. Cognitive behavioral therapy can also help both children and adults. It is important to inform your child's tutors or teachers about his or her condition. This will help the teachers or the caregivers when they go to school to understand them and understand their way of learning and also find a better way in teaching the children so that the children does not feel inferior among their peers. And also the teachers will also find a way to boost the confidence of these children so they don't grow up into their low self-esteem and then poor self-image. They don't develop that poor self-image into their adulthood. And if you're an adult, to inform your employers about your condition. You need to be conscious of yourself. You need to be aware of the condition that you are having. This will also help the employers understand you and understand your style of work. They will also have patience with you when you are working or when you are interacting with them. I'll see you some other time. Do enjoy the rest of your day. Bye.